And I'm happy to introduce our next speaker, Dr. Hazel Snyder from Alzheimer's Association. She is Vice President of Medicaid and Scientific Relations at the Alzheimer Association. She oversees association initiatives that accelerate innovation, Alzheimer's research, and provide opportunities for the global dementia community to connect and collaborate. And her presentation title is Alzheimer Association Resources and Grant Program Overview for Health Research. So please, Heather, I see that you already shared your screen. So you're very welcome. You can start your presentation now. Thank you.
Excellent. Well, thank you so much. And you can hear me okay, I hope?
Yeah, that's great. I can hear you.
Excellent. Excellent. Well, it's a pleasure to be here with all of you. I'm only sorry that we're not in person. I'm here representing the Alzheimer's Association, and today I'm going to share a little bit about the recent Alzheimer's Association facts and figures that was just published in the last week, and use this as a way to talk about some of the ongoing association priorities and activities and where this fits into our research funding, our program, and some tips in terms of hopefully those that are joining today will take the learnings from today and apply this to their research studies and apply for funding, maybe from the Alzheimer's Association. And I'm hoping we have a couple minutes for questions at the end. But if not, of course, I'm happy to answer them offline as well. So I'm going to talk a little bit about the recent facts and figures report that was published by the Alzheimer's Association. You may have seen some of the headlines around perceptions and experiences related to Alzheimer's care or caregiving. And some things that we learned this year and that were new in this year's report are that there are currently more than 6 million Americans age 65 and older living with Alzheimer's. This number is expected to continue to grow if we don't have a way to stop or slow the progression. COVID-19 is hitting people with Alzheimer's and other dementia hard. And in fact, we saw a 16% increase over what we would have expected of deaths due to in 2020. And so there's still a lot of I think, work, and we'll continue to see the impact that COVID-19 has had on people with Alzheimer's. And for the third year in a row, the disease-related cost has continued to rise. So in 2021, the estimated expense was $355 billion. So this was up 50 billion, that's 50 with a B, from 2020. And we anticipate that that number will continue to rise. And between 2000 and 2019, we saw deaths due to Alzheimer's increase by about 145%, while deaths due to other disease continue to decrease. And we continue to see the data emerge around gender and racial differences in Alzheimer's prevalence, with almost 2/3 of those with Alzheimer's in the United States are women. Older Blacks and Hispanics are disproportionately more affected than older whites to have Alzheimer's and other dementias as well. So in terms of caregiving, we see some of the new data suggests that there's about 11 million people Americans that are providing unpaid care, which is over 15.3 billion hours of unpaid care. And some new data that we saw this year, and I will say that research is limited when we look at diverse populations and their experience in caregiving, but Black caregivers, for instance, are more likely to provide more than 40 hours of care per week compared to a white caregiver. And they're also more likely to be caring for someone with a dementia. That's 31% compared to 11.9%. We also saw that Hispanic, Black, and Asian American dementia caregivers indicated greater care demands, less outside help or formal help in terms of their caregiving duty. And it's really essential that we understand these needs so that we have ways and opportunities within the community and within research to make sure that we're addressing them appropriately. So the special report this year focused on race, ethnicity, and Alzheimer's in America. And this was really to understand the racial and ethnic attitudes and experiences regarding Alzheimer's and dementia care in the United States. This was a result of 2 surveys that the Alzheimer's Association commissioned to conduct surveys of US adults and also those that were current caregivers of an individual age 50 or older with cognitive issues. We conducted these surveys in order to have a better understanding of the current racial and ethnic attitudes on Alzheimer's and dementia. And the objective really was to gain a deeper understanding and insights of the barriers of diverse populations and what they're facing in terms of accessing and receiving dementia care. So I mentioned that we conducted 2 surveys. One was in US adults, nearly 2,500 individuals, and one survey was within individuals providing care for somebody with a cognitive issue, and that was in nearly 1,400 individuals. And for the first time ever, this surveys included responses from Asian, Black, Hispanic, Native, and White Americans. And I'm going to talk through a little bit of what we learned in these through these surveys, and that was highlighted in the special report. Discrimination is a barrier to Alzheimer's and dementia care. People of color want healthcare providers who understand their unique experience and background, but many doubt that they'll have access to culturally competent providers. Black Americans lack trust in research, clinical trials, and half doubt that the advances in Alzheimer's treatment will be shared. Knowledge, awareness, concern, and stigma about Alzheimer's varies quite widely across racial and ethnic groups. And in fact, when you look here, you can see that there is, you can see here that nearly 1/3 of Black Americans and nearly 1/5 of Hispanic and Asian Americans believe that discrimination would be a barrier to receiving Alzheimer's care. When we look in terms of the individuals, when we look in terms of the half of Black Americans report that experiencing healthcare, they report experiencing healthcare discrimination, and you can see that here in the middle bar. And at least 1/3 of Native, Asian, and Hispanic Americans also report this as well. And the biggest issue in terms of that discrimination is a significant barrier to concern. The number one reason is not being listened to, and you can see that reported here with approximately 42% of Black Americans say that they're not listened to with their conversations with their healthcare provider. We also say that people of color want healthcare providers who understand their experiences in the background, but many doubt that they have access to culturally competent providers. And you can see that here as well in terms of the percentages of individuals that feel that it's important to have a healthcare provider that understands a person's ethnic and racial background, but their confidence, which is the light blue bars, that individuals have access to this type of care today. So as I mentioned, knowledge, awareness, and concern about stigma around Alzheimer's varies quite widely across racial and ethnic groups. And in fact, we see that here when we're looking at concerns about developing Alzheimer's is lower in Native Americans, Blacks, and Hispanics, especially when compared to whites. More than 1/3 of Native Americans and nearly 3 in 10 Hispanics do not believe that they will live long enough to develop Alzheimer's or another dementia. And more than half of non-white Americans believe that significant loss of memory or cognitive abilities is a normal part of aging. So how do we continue to bridge these gaps? We need to ensure that we're preparing the workforce to care for a racially and ethnically diverse population of older adults. We need to increase diversity in dementia care across the entire board, whether it be healthcare providers, those that are providing care and support, and everything in between. We need to engage, recruit, and retain diverse populations in Alzheimer's research and Alzheimer's and other dementia research and other clinical trials. So what are some of the current efforts that are ongoing today? Well, we need to continue to build and grow national and local diversity, equity, and inclusion partnerships through the Alzheimer's Association, and I'll touch on this in just a moment. We have an ongoing study called New Ideas that is really looking to enroll over 7,000 participants, including 2,000 Hispanic, Latinos, and 2,000 Black African Americans, really building upon community-based recruitment efforts and initiatives and helping to build those networks so that we can ensure that as our understanding of the disease and accurate diagnosis and the tools for potentially accurate diagnosis are available or evaluated in all populations. And Impact AD, which is co-funded by the Alzheimer's Association at NIH, which was launched in the fall of 2020, is aimed at increasing diversity in dementia research, so training that workforce that are doing the clinical trials and ensuring that there is a diverse workforce that are conducting those studies as well. I mentioned in passing the building of the national partnerships, and this is just to name a few that the Alzheimer's Association has continued to grow in recent years. I think many of you that are here, and I think heard from him earlier today, Dr. Carl Hill is the association's Diversity, Equity, and Inclusion, a chief of Diversity, Equity, and Inclusion officer, and is the lead for many and all of these partnerships. Part of what is in part of this engagement is training, building volunteers, the community engagement, engaging communities in activities like the Longest Day, the Walk to End Alzheimer's, conferences and other events, participating in advocacy, raising awareness, and again, building that workforce around research, ensuring concern and awareness and access to education and materials and other resources that will help build the community and hope to start addressing some of the barriers. So in summary, this facts and figures report really shines a light on some of these barriers and suggests that discrimination and lack of diversity in the healthcare profession are significant barriers, and they must demand our attention. There's already a devastating burden of Alzheimer's that must not be made worse by discrimination and health equities in the current system, and it's our obligation to make sure that we address this. And the Alzheimer's Association is committing to reducing health and healthcare disparities, particularly as they impact older adults and their ability to access high quality dementia care. So the Alzheimer's Association, in terms of, I talked a little bit about facts and figures. I alluded to some of our national partnerships. We are a voluntary health organization. We are the world's largest organization dedicated to Alzheimer's and dementia. Our three-part mission is in terms of care and support, advancing research and public policy, and overall raising awareness of potential risk and addressing those through all of the other arms. We are in communities all across the country. And in terms of the research arm, which I'm going to talk a little bit more about in the next 15 minutes or so, the association is the largest nonprofit funder of Alzheimer's and all dementia research in the world. So today we have a little over 600 projects that are actively at work in 31 countries, totaling a little over $210 million. And our research funding is across the entire spectrum. So looking at cells in a dish, all the way through clinical trials and everything in between in terms of what are the best strategies of care, of support for individuals, and how do we assess those, what are appropriate outcome measures, and everything else in between. So in terms of our research strategy, it's looking at a multi-pronged approach where we have opportunities to seed, speed, or scale. So what does that mean? Looking for ideas that we can see. They may be needing some of that initial data, early career researchers, those that have an expertise in another discipline that are looking to come into Alzheimer's and dementia science. So seeding that idea, helping them get that pilot funding that makes them more likely to be successful at seeking funding at the federal level. So I think the last speaker was talking a lot about learnings from breast cancer. So somebody that has an expertise in applying some of those tools and some of the data analytics and algorithms in breast cancer, can they apply that here in Alzheimer's and dementia, and apply some of those learnings and get some pilot data that make them more likely to go on for success at the federal level and scale that up in another way? Are there opportunities that we can speed something forward? So looking at an ongoing potential clinical trial or an intervention study or a study that will follow and assess a group of individuals over time. How can we accelerate the start of that particular study? We recently funded, I think, some work to help bridge a group that was looking at adding in blood-based biomarkers or blood collection called High School and Beyond. So that was an opportunity of really speeding, giving them some seed funding that also allowed them to speed ahead and start the collection of the blood and evaluate it in a way within their study population as they applied for the federal funding to scale up. And then, of course, if there's an opportunity on a larger scale where if we add this one additional measure, this one additional tool, we certainly look for those opportunities as well. So we do fund research through a peer review process. All of our programs require a letter of intent, and those are reviewed and evaluated. Those that submit full applications go through a peer review process, an online peer review process. We then have a review panel that is a mix of both those that participated in the online review process, as well as our International Research Grant Program Council. And that expert review panel comes together, discusses grants, anything that could potentially be within the funding range, and recommends meritorious rankings to the Alzheimer's Association and to our medical and scientific advisory group in order for us to move forward with the funding awards. In terms of our programs, in a given year, we might offer anywhere from, in a typical year, we offer anywhere from 20 to 25 different programs throughout the year. Last year was a little bit of an anomaly, and this year is too, in that we had really one more expanded program than two programs of our core grants. And our core grants are what you see on the screen right now. These are really for early career researchers or those that are new to the field. So let me talk a little bit about these programs. We really emphasize early career researchers, so those that are anywhere from you have your degree, whether it be an MD, a PhD, a DOD, or an OD, or a DO, sorry, an MBB or other in terms of applying. And our clinical science fellowships and our clinical science fellowships to promote diversity are for those that see patients. So that can be, again, people with MDs, ODs, MBBs, or PhDs. But you must see patients in some capacity through your work and through your expertise. Our clinical scientist fellowship to promote diversity, that's really based on the investigator, and we use the NIH definition in terms of diversity, both including ethnic and racial, gender, and socioeconomic diversity categories as defined by NIH. Our research fellowships and our research fellowships to promote diversity programs are for those that are really from PhD prior to being an independent faculty. So anything between, you're no longer a graduate student, but you're not yet an assistant professor. And so anything within that window of time, provided you're within 15 years of receiving your last degree. These are open calls, so we are not prescriptive in terms of the specific area of research, but we certainly look for projects that are innovative and address some of the gaps in our understanding and some of the emerging issues and topics that we see across the entire field. And the last two, the research grants new to the field and the research grants to promote diversity. Those are for individuals that are more at that independent level. So they're at the assistant professor level or the associate professor level, and they really want to explore a new or emerging area. Individuals that apply for the research grants, those are individuals that likely have a background in Alzheimer's and dementia science or some neurodegenerative science. Those that are new to the field are brand new. They're coming into this space without a background. They really have an idea that they want to apply or contribute into Alzheimer's and dementia science, and they're applying with that idea through these programs. One of the big questions that we get is preliminary data required? It is not for any of these programs, and in fact, we're working very hard to make sure that our reviewers also recognize that in their discussion as well. These programs are typically offered twice a year. We did have a pause in the program due to the global pandemic, as we heard very clearly from researchers that there was challenges in applying, and individuals were unsure what their research would look like as we went back into the labs and into the field. But they are open right now, and we are actually in the middle of a review cycle for these programs. And our next call will be in August of 2021. So there's a lot of information on our website. You have on the top screen, alz.org/grants. You can find information about these programs as well as some of our other targeted RFAs, which I'm going to talk about in a second. And of course, you can always reach out. That's our general email, grantsapp@alz.org. You can also always email me, which is just the first letter and my last name at alz.org as well, hsnyder@alz.org. I did want to mention some specific programs that we have. So in addition to our core programs, which I just talked through, we do have some targeted RFAs that are offered throughout the year. Each year, those may be very different. So this year, for instance, we had a clinical trials program that was really targeted for drug trials. We've also had a program that was targeted for drug discovery related to the tau protein in Alzheimer's and other dementia. And then we've also had a program that was focused on understanding the neuroimmune mechanisms and the basic biology. And coming up within the next week or so, we should be launching a program called Advancing Research on Care and Outcome Measurements, or ARCOM. We're anticipating this to be released, I'm hoping next week. We're waiting on some final paperwork with our partner, Brain Canada. And we're doing this in partnership with the Link AD initiative and effort, which is a project funded by the National Institute on Aging through the Alzheimer's Association. The areas of interest for this particular program are looking at outcome and care measurements, and application and evaluation of these measurements, and there is an emphasis on diverse and underrepresented populations. Really, all of these build on top of the person-centered focus of the dementia care practice guidelines that you can see represented in the wheel to the right, or maybe it's the left of your screen. These grants will be, again, the idea is that this is pilot funding to help individuals start thinking about or building different outcome measurements of care for individuals, thinking about application and evaluation of those measurements. And so it looks at things around like scalability. So thinking about some of the different measurements that we have related to care, they're not always necessarily scalable. So how can we ensure scalability, practicality within these measurements, and of course, ensuring that they are applicable to diverse and underrepresented populations. The budget for these will be up to $250,000. And as I said, we anticipate this launching in the next week. So check out alz.org grants for more information as this program launches. And I'm of course happy to take any questions. So given that this workshop is really looking at and focusing on what are some of the opportunities and ways that researchers can leverage large-scale data sets for important questions and looking at important questions, I wanted to highlight 3 researchers that the Alzheimer's Association has recently funded that are doing just this. So the first one is Dr. Walsman, who's looking at state desegregation efforts and Black-white disparities in Alzheimer's or in dementia. And she's using a particular data set known as the Health and Retirement Study, which I'm sure many of you are familiar with. And then she and her team have actually built a database on desegregation practices really across the South from the early 1900s. And so she's actually combining these 2 different data sets together in her analysis and in her work. The next researcher is Dr. Lin, who is doing some work on racial and ethnic disparities in ADRD diagnosis, treatment, and costs. Dr. Lin is using Medicare and Medicaid databases. So there's I think a unique and distinct process in terms of accessing Medicaid and Medicare databases and knowing both how to apply and ensuring the access to the right codes. So I think there's a lot of work that can be done using these data sets and going through these data sets, but also recognizing the limitations of what they are and are not. The last researcher that I just wanted to note is Dr. Aparcio, who's doing blood biomarkers for prediction of vascular cognitive impairment and dementia. He's using the Framingham Heart Study along with another cohort that's available to him at BU. So these are just 3 examples, but in fact, increasingly we're seeing researchers that are looking at work, particularly when they're looking at starting to seed a new idea that they may have in advancing a research question. How can they do this with some of the existing data sets and take that forward? And in fact, the Alzheimer's Association has a tool called GAIN, the Global Alzheimer's Association Interactive Network, that allows for you to ask questions and look at some of these associations on a macro level. And in an aggregated way, look at data sets, look across different data sets from all around the world to start to see if you see those associations, and then you can certainly go and apply for direct access to those data sets. There's a lot of efforts in terms of ensuring that data is shared in near real time or is in close to real time as is possible for use in leveraging some of that work to come together. What GAIN allows you to do is it allows you to take data sets or take parts of data from different data sets and bring it together in a way that no single study would allow you to do. So for those of you that might be applying or might consider applying to the Alzheimer's Association's programs, again, LinkAD is going to launch sometime in the next week if that's applicable to your work and your program, with our other core programs, our early career and new to the field, coming in August of later this year. So just a few tips to suggest in terms of things that we see as being beneficial for applicants. Read the program announcement. It changes every cycle, and call if you have any questions. That's what our team is here for. We're here to answer questions. We're here to give as much input as we're able to give within your development. Your LOI, so we do require a letter of intent. These are all reviewed, and it's not a guarantee that you'll be invited to submit. We do have some very specific eligibility criteria for our programs, and programs may be targeted for a particular area. Like I mentioned, LinkAD, we have specific areas of research that we're looking to address. So think about that when you're reading the RFAs and considering potentially applying. And if you have a question, reach out. That's what we're here for. One of the things that we see over and over is find someone that's really good at getting grants. And not necessarily, it's not about their science, but are they really good at getting grants? And ask for them to review and comment on your application before submitting, or somebody that reviews a lot of grants. Ask them to give you advice. I think we often hear that that how you might frame your specific aims, well, that's important, but it's somewhat of the hypothesis and how they all feed together. And the reviewers may look at these a little bit differently. So how can you make it as the applicant as easy as possible for the reviewer in terms of their read, so that they're going to want to fund you? I can't tell you the number of times that a reviewer really will say this application was a pleasure to read, and I will fight for this application because it's such an important work that really is so clear in how it's been outlined. And if invited, you have an opportunity to identify reviewers that you can include or exclude. So this is if you're submitting a full application to the association. We do have a way that you can include specific reviewers by name or by email. The include is a little bit more challenging. We're not always necessarily able to accommodate that, but we will always accommodate a reviewer that you might exclude from your process. If you apply one time and you're not successful and you decide to reapply, read and pay attention to the critiques and resubmission. I read somewhere that someone said, read it once and then, put it aside and then come back when you can with some fresh eyes. And there might be threads of things that will help make your application stronger. And of course, reach out to us. That's what we're here for. Our goal is for you to be successful. We want to fund your research and we want to make you move forward. And so of course, reach out at any point in time if you have questions in your work. So I just wanted to share a couple other upcoming programs. These are not grants in terms of the funding of research per se, but this is an opportunity in terms of a program, an interdisciplinary summer research program that's also available in terms of advancing your career in dementia science. This is slated to take place in August of this year in Chicago, and the application deadline is April 8th of this year. And so you can find out more at alz.org Summer Institute. But I did want to just share a few things in terms of what the program is and who's eligible. So it's really for early career researchers from the psychosocial and public health spheres invited to apply. This is a no-cost opportunity. So although it's not direct funding of your research, it would be funding you in terms of the career development. They're looking to accept 24 applications, and attendees will look to gain knowledge of the basic clinical and biological aspect of Alzheimer's and dementia, is hone some of the essential research skills around emerging research designs and analytical methods, make connections with leaders and peers in the field, and of course, the ultimate goal is that you'll draft a proposal for the association or NIH for future funding. And I would want to mention also, as I noted in some of my comments, Impact AD, which is one of the other programs, also is open for applications going forward. And then lastly, I did want to mention that the association is really excited to be convening with funding in part from an R13 from NIA, addressing health disparities, looking at health disparities across Alzheimer's and all other dementia. This will be a virtual conference, June 14th to 16th. It is free to attend, and you can find out more at alz.org Health Disparities. And so with that, I leave you with the association's overall vision of a world without Alzheimer's disease and all other dementia. We're only going to get there with all of you and the work that you're doing, discussions like today that will improve and advance our research going forward. And so I do see that there's a couple questions, and I think we have a couple minutes or maybe a minute, but I'll pass it back to Julie. And just again, thank you all so much for having me today.
Yeah, thank you very much, Heather. That was really great presentation, very detailed presentation. And I can tell you we have like a couple of questions. I think you can respond to these questions from the audience. The first one, could you please elaborate on the acronym GAIN?
Yeah, absolutely. So it's GAAIN. And I will respond. I'll type an answer in as well to the question so that I can send you to the link. It's the Global Alzheimer's Association Interactive Network. So it's a federated network of data sets that are around the world. And again, you can look at specific data variables and make those linkages to look at associations. Some basic statistical analyses are available within GAIN, but of course, much of what you'll all be doing will take that to a different level of some of the analysis and some of the assessments, algorithm building. So it would give you an idea of where to look for the data that would be helpful with your particular program or your particular research question.
Okay, thank you very much, Heather. And we have one more question. Are graduate students eligible to apply for this program?
Yeah, great question. And unfortunately, the core programs are not open to graduate students, but where we do have an opportunity for graduate students, and I didn't mention this today, is through the Alzheimer's Association's Interactive Network. We do have a fairly robust travel fellowship opportunity that you can apply for travel fellowships to attend AAIC in person. And that typically opens around January or February or so for the application cycle. So that is an opportunity that is open to graduate students as well.
Thank you. Thank you very much, Heather. Thank you.
Thank you so much.